Hi everybody, my name is Lulu Achua, and today I'm gonna be doing the cranial nerve assessment. I'm gonna be assessing cranial nerve 1 through 12, and right here I am with my patient, Miss Amel. Hi, Miss Amel.
Hi.
So today we're gonna be assessing your cranial nerves, okay? And for this procedure, before I start, I have to introduce myself to the patient, which I just did, and gather my supplies and wash my hands, which is hand hygiene. And I identify my patient with the two forms of identifier. Miss Amel, can you please tell me your name and date of birth, please?
My name is Abel Kwa. I born on August 1974. August is 16.
Okay. So while she do that, I also cross-check with her armband to make sure I'm having the right person. Yes, so that's a two form of identification. And right now I have verified the doctor's orders. I provide privacy for my patient. And okay, let's start with cranial nerve 1. So I'm gonna be you're gonna close your eyes for me, and I'm gonna show you put something for you to smell, and then you tell me what smell you got. Okay,
Okay.
close your eyes please.
Vanilla.
Okay, that's right. You can open your eyes, and this is vanilla. So when you are doing the smell, always make sure you get something, a smell that is pleasant, not the unpleasant ones. So vanilla is one of the pleasant ones. The next, we're going to be doing the cranial nerve 2, which is the optic nerve. And for the optic nerve, we're going to be checking on the confrontational and the visual acuity, which is by using the Snell chart. So let's do it, Miss Koa. Please, Miss Koa, stand up. Let's do the test. So you're going to be standing a little far from me, at arm's length. Okay, so you're going to close your right eye for me, please. Just close your right eye. Yes, while I close my left eye. Then you're going to try to tell me how many fingers without looking at my fingers, okay?
Okay.
So, how many fingers do you see?
2.
Okay.
3.
Okay. Yeah, so that nerve is fine. Now you're going to close your left eye for me. Left eye.
Oh.
Your left eye. While I close my right eye, I'm going to do the same procedure, okay? So just tell me how many fingers you see.
1.
Okay.
3.
Okay, good. So that nerve is okay. So next, I'm gonna make my patient to read the vision acuity test using the Snell chart. I do not have an actual Snell chart, but I've improvised with this. So I make my patient to stand like 20 feet away from my chart, like so. Do you use glasses? Yeah. So you can use your glasses if you do use glasses.
Okay.
Okay, so since I don't have the actual chart that have just the letters, we're going to use this one, and then instead of the words, just tell me the letters, starting from the smallest you can see from the bottom.
Okay.
Tell me the letters from the bottom, then we move upwards.
Okay.
Okay, close one eye, close the right eye.
Yeah.
Yes. Okay. Can you please read?
On the top.
From the bottom.
Bottom. M.
Yeah.
O. T. I. C. E.
Okay. Close the other eye. From the top.
U. S. T. H. E.
Okay, that's good. So she can do well with both eyes. She can see the smaller one from the bottom and the bigger ones on top. So that makes her vision 20/20 because she can see up to the line 8, which is the vision 20/20. So next we're gonna be assessing the ocular motor nerve 3, the cranial nerve 4, which is a trochlea, and cranial nerve 6, which is the abducent. So now I'm going to be using my pen light to check for involuntary movement of the eyes, which is called stagmos. And by doing so, I'm going to be using this pen light, please. And don't move your head. Just keep your head straight, and then just keep with your eyes, follow wherever I move the pen to, okay? So I'm going to keep it a distance away from you, like so. So just follow with your eyes, not by moving your head. Okay. Next, I'm going to be using my pen light still to shine it on your eye, and I'm going to start from one corner. This is to check how the pupils dilate, that is the perla. And let's do it like this. Don't follow the pen, just keep watching at me, okay? Okay. And like so. Okay. Now I'm going to still use the pen light to see how your pupils constrict, how they dilate, and if they do accommodate. So by so doing, I'm going to use the pen light. It will be close to your nose, closer to you. So keep looking at the pen light. I want to see if your eyes could cross each other. Yeah, so just keep looking at the pen light. Okay. So at this point, I will document my findings on the eyes, like the pupils are equal. Pupils are equal. So the pupils are equal, round, reactive to light, and accommodate. Next is to check the cranial nerve 5, which is the trigeminal nerve. So can you please bite down your teeth? Just you can sit down. Bite down your teeth while I feel the masseter muscle and the temporal muscle. Okay. So the next thing is, can you please open your mouth for me? Then push down, push down, push. Try to push my hand down with your mouth. No, while your mouth is open, just try. Okay. All right. Thank you. Moving on, we are going to cranial nerve 7, which is a facial nerve tick. So now please, can you close your eyes tight for me? Frown, smile, pop out your cheeks, like, good, okay. No pain, right?
No.
Okay, open your eyes. Next, we're going to test cranial nerve 7. So, sorry, next we're going to check the cranial nerve 8, which is a vestibulocochlear nerve. So next, to test for this, I'm going to cover one of your ears, and I'm going to whisper 2 words on so that you can tell me what 2 words I did, okay? Mango, light.
Mango light.
Good. That was the 2 words I whispered. So I'm going to do it for the other side as well.
Okay, and that nerve is intact. Next, what we're going to do is we're going to assess
Mango
cranial
light.
nerve
Okay.
9, the glossopharyngeal.
Now with my spatula, I'm going to be testing cranial nerve 9, which is a glossopharyngeal nerve. So what I'm going to do, I'm going to be using the spatula. I'm going to use the spatula to push down your tongue, and I would like you to say ah. And after that, I'm going to be putting it a little further to check for your gargleness, okay? Say ah. Okay. Okay, that's good. So moving forward, we're going to be testing cranial nerve 10, which is a vagus nerve. So with the vagus nerve, I say vagus is intact because she's able to talk to me without difficulties. She's able to swallow. She's able to eat and drink without problems. Next is the cranial nerve 11, which is the accessory nerves. Now we're going to be assessing the cranial nerve 11, which is the accessory nerves. So please, can you move your head side to side? Front, back. Okay, and can you shrug your shoulder? Okay, she does that with ease. Finally, we come to cranial nerve 12, which is a hypoglossal nerve. So for this now, I want you to stick out your tongue and move it side to side. Side to side. Okay, she does that with ease, and that's fine. Now we have come to the end of this assessment, and thank you all for your patience. So at the end of this, I make sure I document my findings. I document how the patient tolerated the procedure, and any abnormal findings have to also be documented. Thanks.